My name is Dr. Wendy Wood Swafford. I'm the Vice President, Medical Director of Blake Children's and Women's Services. Our partners at the Iowa SIDS Foundation connected earlier this year to alert us to an alarming trend of infant deaths that had occurred from SIDS and unsafe sleep practices, and the rise that was occurring in the state of Iowa. We unfortunately were aware of this trend because over the last several years since the pandemic, we had seen an increasing number of infants being brought in through our emergency department that had suffered a SIDS death. It was alarming to us as pediatricians and alarming to our community, and we wanted to get to the root of the issue. We're grateful that you agree that this is important enough to spend time and dedicate some education to this morning. And we appreciate our public health experts for being present today to help us share the information that we've gathered about safe sleep practices and how we can offset this trend that's occurring throughout our state. Everyone here today is committed to educating parents, committed to educating our provider community, committed to alerting everyone of this awful rising trend. We are so grateful that they are here and engaged, and we're grateful for the work that we are about to embark on and for our ability as a children's hospital and a community in Des Moines who cares for children beyond anything that I've ever been a part of in my life, how our community reaches out to support and provide care and a foundation of support for children so that we can reach every child through not just out the Des Moines community, but throughout the state of Iowa. We have incredible collaboration throughout the hospital systems and throughout our community supporters and throughout public health to provide incredible care. Our job is to preserve life. Our job is to make sure that all children have the right and ability to grow up and live healthy lives. We want to raise awareness to this subject. We want there to be global attention of this issue, and we don't want to have this be the number one rising thing in the state of Iowa. We need your assistance. We need your support. So thank you very much for being here today. Thank you for the time you've dedicated to pay attention to our experts, and I look forward to kicking this off with our teams.
The Iowa SIDS Foundation is a local nonprofit located centrally here in Iowa, but we serve families all across the state of Iowa. And our two main goals is to provide grief and bereavement support to families who have experienced the unimaginable loss of an infant due to sudden, unexpected infant death. And then our second role is to provide outreach and education to the community about how to reduce the risk of SIDS and prevent accidental sleep-related deaths. Unfortunately, in the last year, since October of 2023, the Iowa SIDS Foundation has been connected to 34 newly bereaved families experiencing the loss of an infant who's died suddenly and unexpectedly during sleep. A lot of these deaths do include unsafe sleep practices. This includes families from 18 different counties across the state of Iowa. Over the last 3 years, there has been a steady increase in families who've been referred to our foundation for grief and bereavement services. We've had over a 70% increase in referrals to the foundation for grief support after a family has experienced a sudden unexpected infant loss since 2022. As Dr. Woods mentioned, we are glad we're all here today, and we want to promote and really appeal to the communities and public to take safe sleep seriously and really listen and follow the guidelines that are scientific and research-based. The majority, of these sudden unexpected infant deaths, like I mentioned, are preventable, and these preventable deaths have involved infants sleeping in unsafe sleep positions and environments that are leading to suffocation and asphyxiation. Many of these deaths also include infants sharing a soft sleep surface with their caregivers, like an adult bed or a couch. And these deaths are happening to babies in their homes and also in childcare environments as well. So now I'll turn it over to Dr. Cruz to share a little bit more information with you concerning some data and programs and outreach.
Thank you, Casey. So I'm Dr. Robert Cruz. Good morning, everyone. I'm the Division Director of Public Health and the State Medical Director for Iowa Department of Health and Human Services. Thank you again for being here and raising awareness about safe sleep and sudden unexpected infant death. I'd like to begin by highlighting some of the data regarding these tragic and preventable deaths here in Iowa. In 2020, Iowa tragically lost 988 children under the age of 18. And of those, about 144 were due to sudden unexpected infant death or unsafe sleep practices. This means that 26.8% of all infant deaths under the age of 1 were related to unsafe sleep environments, a stark reminder of the urgent need for action in preventing these unavoidable tragedies. When we look at how Iowa compares to the rest of the United States, we see that between 2018 and 2022, about 89 out of every 100,000 babies in Iowa died suddenly and unexpectedly while sleeping. This is slightly lower than the national average of 95 per 100,000. And while it's reassuring that Iowa is doing better than the national average, we must continue working to make safe sleep for every baby and prevent any more of these devastating losses. Unsafe sleep environments continue to claim the lives of our youngest Iowans, which is a heartbreaking reality that we simply cannot accept. Iowa Department of Health and Human Services is committed to reversing this trend through both immediate actions and long-term strategies. To address this, Iowa Health and Human Services has taken an important step by creating a new position, a half-time safe sleep coordinator. This is the first position of its kind within our agency, and the safe sleep coordinator will begin bringing together key stakeholders to develop a comprehensive set of safe sleep strategies to the program areas we serve. Their role will also include working with medical students and providers to raise awareness across the state, ensuring the future and current parents and caregivers receive evidence-based education during the prenatal and postpartum periods. We're also strengthening our partnerships, particularly with the Iowa SIDS Foundation, to enhance our messaging and outreach efforts. Through the foundation, we've allocated public health block grant dollars to update and create new safe sleep materials and to provide emergency resources like pack and plays to families in need. At the Iowa Department of Health and Human Services, we're committed to promoting the safest sleep environments for our youngest Iowans, and our efforts to improve safe sleep extend across several key areas. First, we've engaged closely with the child care policy community to identify and implement ways to enhance safe sleep practices within the home child care centers. By working with those on the front lines of caring for infants, we ensure that children are kept safe in environments and prioritize their health and well-being. Additionally, we're providing families and resources on safe sleep practices right from the start. When parents receive their child's birth certificate, they also receive information on safe sleep recommendations mailed with it from our Vital Records Department. This simple step allows us to ensure that every family is equipped with the knowledge to keep their baby safe. And finally, the Iowa SIDS Foundation conducts annual trainings for child care providers emphasizing the most current safe sleep practices. These sessions also focus on debunking the myths around certain products that claim to prevent SIDS but are not backed by science. We want to ensure that the child care providers have the most up-to-date information to make informed decisions that protect the children in their care. Thank you. I'm going to turn it over to Chloe here.
Good morning, thanks for having me. I'm Dr. Chloe Butler. I'm a pediatric hospitalist at Mercy One Children's and medical director of the newborn nursery at Mercy One Des Moines. So I'm going to walk through the ABCs of safe sleep and talk about how a baby should be sleeping. So briefly, ABC stands for alone, on your back, in a crib. And each of those components has a couple details to walk through as well. So first step, alone. All babies should have their own separate sleep space, a bassinet, a pack and play, crib, something separate from any sibling, even if there are multiple, and any caregiver. The AAP recommends that you room share but not bed share. Second, on your back, all infants should be placed on their back to go to sleep, and this holds true through the months where they start to roll as well. Typically, once babies can roll, they have the head control to protect their airway, but you really don't want to get them there before they're able to do it on their own. So if they roll onto their tummy through the night, you don't have to flip them back over, but they should always be placed on their back when you go to sleep. And then third, the crib, and we have our example crib here. So the first is that the mattress should be firm. When you set the baby down, they should not sink into it at all. Again, they do not have the head control to protect their airway on a soft surface. Second, it should be flat. So everyone has a friend or grandma or someone who says that if you have a spitty baby, you should incline the bed, and that is just not true. There's no recommendation for that. Babies who spit up are actually safest on their back. This is one of the most common questions we get in the nursery. because if you are flat on your back, your esophagus is below your trachea. So the path of least resistance is for that spit up to just go right back down to the stomach. And I always remind parents that their babies do have normal reflexes. So if they spit up, they're going to cough and swallow it back down. Lastly, you should have only a fitted sheet over that mattress and nothing else in the crib. So no bumpers, pillows, blankets, stuffed animals, toys, no monitors or mobiles on the crib, just kind of a blank surface. There's a couple things aside from those ABCs to remember. The first is that if a baby is in a car seat and falls asleep in the car, that is okay for them to sleep. But once that car stops and you take that car seat out, you need to return that baby to a safe sleep situation consistent with the ABCs. And then, as kind of mentioned previously, caregivers frequently, I think, remember these things during the day, but kind of lose track of them they remember them at night, but lose track of them during the day when that newborn is kind of napping anywhere around the house. And when they're tired. So always remind caregivers that if they're feeling sleepy at all, they need to place that baby back in its own separate crib, consistent with the ABCs. So again, alone on your back in a crib. And then I will turn it over to Dr. Bush.
Hi, I'm Audrey Bush. I'm a pediatric hospitalist here at Blank Children's Hospital. I'm also medical director of our inpatient pediatric, general pediatric unit, and I serve as medical advisor for the Iowa SIDS Foundation as well. As Dr. Butler said, you know, really, at the end of the day, sleep for a baby is simple. It is as simple as ABCs. The hard part, I think, as a parent and a caregiver these days is that we're often told that more is better, right? So the more technology, the more devices that we can add, the more complicated things are, the better it has to be, right? And I think as a parent, that can be very confusing. As Dr. Cruz mentioned, there are devices out there that are marketed as safe for sleep or even potentially safer or preventing SIDS or preventing sleep-related deaths. And that isn't true. It's just not true, and the data's not there, but they make these claims. And so one really important thing for parents and caregivers to know is it really is as simple as those ABCs. We really do want a baby on a simple, flat, safe space of their own with a firm mattress and nothing extra in that crib. I think at the end of the day, I think that really is the kind of most important thing. When you're in the hospital in the newborn nursery, there are things we do that we hope will provide education, but also model that. So some efforts that we've made at Blank over the last several months and years that kind of represent that and we hope parents see. We provide, obviously, those safe, flat surfaces, but we've also transitioned away from traditional hospital linens for these young infants under 1 year of age and moved to fitted sheets for bassinets and for cribs. And that's a really important thing, to have that fitted sheet so nothing can get loose around the baby. The other really important thing that happens and we think is important to model at home is a lot of people have grown up, again, with parents or grandparents talking about sort of the traditional swaddling blankets. And taking that blanket and swaddling it. And a lot of time, in the past you would see that in the newborn nursery as well with a newborn. What we know is that those blankets can be dislodged, and it's another opportunity for a baby to have their face covered or have a suffocation-related event. And so in order to model that, we have switched to sleep sacks for infants. And so that's a simple thing that parents can buy at the store, but also that we send home with every baby that leaves the nursery here at Blank. But these simple sleep sacks are a way that the baby can still be secure and swaddled and placed safely on their back, but don't have an opportunity to become loosened up and cover their face. And so at the end of the day, I think that's what's most important for parents to know is that the simplest option is going to be the safest option. We want a safe spot that is dedicated to that baby with the fewest things added in. Thank you. I'll pass it on to, I think, Brittany.
Thank you so much to our panel of experts. My name is Brittany Haskins. I am the Childbirth Education and Postpartum Coordinator for Unity Point Health Des Moines. We did want to open it up to you all for questions. I know we do get some really common ones from expecting parents who are in classes, so I did want to make sure that we addressed a few of those, specifically regarding wearable sleep devices. I did want to also invite up Dr. Amy Ferguson, since my chair is now empty. She's the director of our newborn nursery, and she was instrumental in getting Blank certified through Cribs for Kids. We are Gold Safe Sleep certified here at Blank, and that's kind of a really big deal. It was not an easy task, and so we have Dr. Ferguson and her panel of experts within the hospital to thank for that. Because the mics are here, we will have you come up and answer as you're willing, but I did want to address anything specifically about wearable sleep monitors. Do they create a false sense of security, or do you find them to be helpful?
Hi, so I'm Amy Ferguson, one of the peds hospitalists with Dr. Bush, and then the medical director of the newborn nursery. Wearable sleep devices, I think, get marketed as something that will go and prevent their baby from having a sleep-associated problem. But when you look at the research, none of those have actually been shown to prevent SIDS or a suffocation incident. What we know has gone and decrease cases is by babies being alone on their back and in their safe sleep environment. When I talk to families about those devices, I feel like they create a lot of alarm fatigue for the family. So a lot of times those will go off and then they will be stressed, obviously, but their baby looks totally fine. So I think that also goes and leads to more kind of concern from the family when the baby is otherwise normal. So I try to go and encourage families to not use those devices because they have not shown, the evidence does not support them. And really, I think it causes them a lot more stress when they are already stressed out with being new-time parents.
Thank you, Dr. Ferguson. And Casey, a question that we get, if you can explain a little bit more between a true SIDS death and maybe an unsafe sleep death, and people who say, well, he can hold up his head now, so I don't have to worry about safe sleep. Can you talk more about that?
So sometimes the terminology does get confusing between SIDS, sudden unexpected infant death, or called SUID. So these terms are sometimes used interchangeably, but they are different, and so it is important to make that distinction. So a true SIDS death, that stands for sudden infant death syndrome, these are not entirely preventable because we don't know the cause of SIDS. So this involves an apparently healthy infant under the age of 1 who was placed to sleep in a safe environment and never woke up. And through a thorough case investigation that includes an autopsy, examination of the death scene, examination of mother's clinical history and infant's clinical history, even after all of that, there's no cause of death that can be found. And so SIDS is a diagnosis of exclusion, meaning they've excluded possible cases of suffocation or asphyxiation, and there still is no cause of death found, so the terminology that's used is SIDS. In contrast, sudden unexpected infant death, these involve infants that die for known and unknown reasons. So SIDS is a subcategory of sudden unexpected death with an unknown cause, but there are subcategories of SUID that involve known causes, such as suffocation or asphyxiation. And so those are preventable. We can prevent suffocation from happening to an infant, and we can prevent an infant from being strangled in their environment or experiencing asphyxiation. And so that's the distinction there. And the majority of the deaths are preventable, are categorized as sudden unexpected infant death. So the true SIDS are really in the minority there, and those other deaths are really what we can prevent and could save a lot of lives. So when we're talking about these sleep-related deaths here today specifically, we're talking about infants from birth to age 1. After the age of 1, the terminology changes and there's different things. But today, we're talking about that first year of life, those first 12 months. And we have families at the foundation that are referred to us for grief and bereavement who experience a loss days after their baby's born. And then we also have families who've experienced a loss at 11 months or at that 12-month mark. So it can happen at any time in that first year of life. Majority are happening in the first 6 months. So that's why this education early and before baby's born is really important, but we're focused on that first year of life.
And I want to highlight a couple other partnerships that I know that we have here at Blank, but also in the community. I know our partners at Broadlawns will give out pack and plays to families who need them for safe sleep environments. I'm sure Mercy has a similar situation. We are lucky to partner with the Genezer family, who started Hannah Safety for All in conjunction with our safety store downstairs. They've actually given away over 300 pack and plays since 2019 to various people within our hospital and also Greenfield, which is that's hundreds of babies possibly saved because they have safe sleep environments because their parents spoke up when they came in and said, actually, I don't have a safe place for my baby to sleep. Also, Variety, the children's charity, partners with all 3 hospitals and gives away those sleep sacks. So thank you, Variety, whether it's through our newborn nursery or Mercy or Broadlands or the NICU, so that babies can go home and also have safe sleep situations. I did want to ask about Mamaroos, DockATots, the not bassinets, pack and plays, or cribs. If it's during the day, can my baby nap there or not so much? Dr. Butler, do you want to take it? They're always coming out with something fancy.
They are always coming out with something fancy. So the short answer is no. You should always be in that safe sleep environment if you are asleep, even if your parents are sitting next to you on the couch next to that DockATot. That is a soft surface. It has padded bumpers. It is not a safe sleep environment. Interestingly, every couple years you see another one of these swings recalled for infant deaths, and it's always only that individual swing. So the rock and plays were in the news everywhere 4 or 5 years ago. All of those got recalled, and this time around it's just it looks like a monkey instead of whatever the rock and plays were. All of those swings are the same mechanism. It's that inclined sleep position where their head can fall forward and obstruct their airway. It's padded on the sides. If the infant rolls, they cannot roll back to their back. All of them are the same mechanism of injury, and instead of recalling the mechanism, we continue to recall just one device at a time.
But if you truly don't have the means, there are many places in town who can help you, whether you are still pregnant or if you're like, oh no, but my twins have been sleeping together, we can get you a second safe sleep space. So whether you're a patient at any of these 3 places, or if you walk into the safety store and say, hey, I need some help, we can connect you to resources within the community. Maybe it's through your MCO or a WIC organization, but there's so many places truly throughout the state, not just here in Central Iowa, who want to help you get safe sleep spaces for your child.
Where is the safety store?
It is on North 1 in the Iowa Methodist Medical Center. You just walk in, hook a left, there it is.
So the car seat is different in the car than out of the car because it's within that base of the car that holds the baby at a very specific angle. Once you take it out of the car and set it on your floor, it rocks forward a bit and puts you at risk for that large infant head to fall forward and obstruct the airway. I know it's incredibly difficult because once they're calmly asleep, and a lot of babies like to sleep in their car seats, you want to just carry them in the house, but there have been deaths from parents doing that, so it is very important to take them back out of that car seat.
Kind of along the same lines of what you mentioned is you get the baby to sleep and they're asleep finally, like don't touch them, leave them alone, right? And so we all want to acknowledge here that while we're talking about the ABCs and it's easy to remember and it's simple, we also acknowledge that sleep is hard, and it's hard for parents, especially that first year of life, because just because you put the baby to sleep alone on their back in a crib doesn't mean they go to sleep and stay asleep. And so we all acknowledge that and understand that it's really difficult for parents. They're sleep deprived, they get sick, there's sleep regressions, there's lots of different things that come up. And so we understand that, and we're still saying that it's going to be hard, but it's worth it because it's your baby, right? And so we want to encourage caregivers to follow safe sleep recommendations at all times for every sleep, naps, and nighttime, regardless of the circumstances. And also encourage providers to talk about expectations when it comes to infant sleep so that parents don't have misconceptions that if they do this, their baby's going to sleep and it's all going to be great, but can be prepared for how to handle difficult situations and keep their baby safe at the same time.
Mine didn't sleep. And we do want to have this be a starting point conversation for the other caregivers in your lives. We realize the ABCs are maybe newer, especially to grandparents or older generations, and you might get, well, you slept on your tummy, you were fine. That's called survivorship bias. So this should just hopefully be a starting point for education. We all have a ton of resources online for free, videos about how to swaddle, when to stop swaddling, and how to have those conversations, whether it's with a daycare provider or grandparents, not to be accusatory, but just to make sure that we're all on team safe baby. Because really, you know, this can be, probably sleep is one of the trickiest conversations to bring up with a new parent, but it's also one of the most important, I think, as you've figured out today.